Hi, beautiful people. Welcome back to my YouTube channel. If you're subbed for the first time, you're welcome. My name is Shalona, and on this channel, we create contents on faith, on health, on nursing, as well as makeup. So, if these are the kind of contents you're looking out for, don't forget to subscribe, like, as well as share the videos. Now, in the society we live in today, a couple that is finding it difficult to conceive, immediately the blame is being thrown on the woman because they just believe any person struggling to conceive, once a couple is struggling to conceive in a marriage, it's definitely the woman's fault. And most times, the husband, sometimes in extension, the husband's family, and even the woman's family will end up blaming her, thereby adding to the already existing pressure she's feeling from outsiders. Because outsiders will definitely, if your family is blaming you for finding it difficult to have a child, outsiders will do times 100. So now, as a result of that, I decided that we should talk about male infertility. People don't know that there's something called male infertility. So today we're going to talk on male infertility. We're going to dissect what exactly male infertility is. We're going to look at the causes of male infertility, the signs and symptoms, if there be any. We're going to also look at the risk factors of male infertility, as well as diagnosis, management, and prevention. That being said, let's dive right into the video. Now, what is male infertility? Infertility, first off, is the inability to achieve pregnancy after a year of unprotected sexual intercourse. Therefore, the inability to get a fertile female pregnant after a year of unprotected sexual intercourse is male infertility. Now, what are the causes of male infertility? Now, we have what we call arteries and veins in the body. Now, the arteries take blood away from the heart to other parts of the body, while the veins take blood or convey blood from other parts of the body back to the heart. So, in a situation whereby the veins, which are present in the testicles, are enlarged, it could lead to reduction in the quantity as well as the quality of the sperm produced. And this is what we call varicocele in medicine. Secondly, another cause of male infertility is infection. Now, infections like epididymitis, which is inflammation of the epididymis, or orchitis, which is inflammation of the testicles, as well as other sexually transmitted infections, can affect spermatogenesis, which is sperm production. Now, in the long run, this could lead to irreversible damage to the testicles. Ejaculatory problem. Now, during ejaculation, if the semen should go into the bladder as opposed to coming out through the male genitalia, it could also cause male infertility. And this could happen when the person had like spinal injuries or he has had surgeries to the bladder. So this could probably happen. So secondary to these conditions. Another is autoimmune conditions. Now, in autoimmune conditions, the body's immunity fights against the body's own cell as opposed to fighting against foreign bodies. So, fighting against one's own cell, for example, the sperm cell, it thereby eliminates the sperm cell. And when this occurs, definitely there's going to be cases of infertility. Tumors and hormonal imbalance. Now, the presence of tumors, benign or malignant tumor, can affect reproduction. Also, when there is excessive production of certain hormones like prolactin or insufficient production of certain hormones like testosterone, it could affect conception. Another cause could be undecided testes or chromosomal defects. Now, during fetal life, the testes are located in the abdomen, but as an individual is born, it moves down to the scrotal sac. Now, failure of the testes to descend down into the scrotal sac could in turn cause infertility. Also, when there are chromosomal defects, problems with the chromosome, for example, we have the Klinefelter syndrome and all that, it could also affect reproduction or conception. Finally, we have coitus problem. Now, in a situation whereby we have challenges with sexual intercourse, it could definitely in the long run affect fertility. For example, for a man who suffers from erectile dysfunction or premature ejaculation, or sometimes there is abnormality in the anatomy of his own reproductive system, it would lead to fertility problems. Having known the causes, let's look at the risk factors. Number one risk factor is smoking and alcohol consumption. Mind you, for every condition, one risk factor for every condition we have is smoking and alcohol consumption. Now, for fertility or infertility. Now, in the case of infertility, smoking and alcohol consumption could reduce the sperm count or even lead to erectile dysfunction. Also, we have medications and treatment. Now, certain treatments and medication could lead to infertility. For example, long consumption of non-steroidal anti-inflammatory drugs, which includes your ibuprofen, could lead to infertility. Apart from that, we have physical injuries. Now, direct injuries to the testicles definitely could lead to infertility, as well as surgeries to the testicles. Being overweight and also exposure to certain chemical agents like during radiation or chemotherapy, this could all predispose one to having infertility. Now, what are the signs and symptoms of infertility? Now, signs and symptoms of infertility are not limited to this I want to talk about. We have pain. There could be presence of pain or swelling in the testicles. There could also be what we call gynecomastia, whereby in a man his breast grows big like that of a woman, so we call it gynecomastia. There could also be problems with sexual health or sexual function. Now that the man is finding it difficult to get the woman pregnant, what are the possible tests that are going to be carried out to diagnose the person with infertility? Number one is what we call semen analysis. Semen analysis, there is analysis of the quality of the sperm that is being produced, also the volume of the sperm that is being produced. There's also analysis of the morphology of the sperm, its motility, which is the movement, as well as the density of the of the sperm produced. We also have the anti-sperm antibody test, which is carried out to find out if there's presence of antibodies that fight against the sperm cell. Also, what we call hormone analysis, where you've tried to find out, is there overproduction of this hormone or underproduction of this hormone, like I explained earlier. Genetic testing, as well as magnetic resonance imaging. Now, these are the different types of tests that be carried out before one can be diagnosed of male infertility. Now, how is this condition being managed? Now, management of this condition depends on the cause of the condition. Okay, now in situations whereby the cause of this condition is sexual functions problem or problem with sexual intercourse itself, certain medications can be administered to the individual to help with sexual intercourse. Also, hormone therapy can be carried out in situations whereby there's overproduction or underproduction of certain hormones. Now, in situations whereby there is presence of varicocele, for example, which I said was the swelling of the face, presence in the testicle, surgical interventions can be carried out to repair the varicocele. Now, apart from that, we have other means of conception, which includes artificial insemination. We also have in vitro fertilization, where the egg of the woman and the sperm of the man is taken together, brought together for fertilization to occur, and once this has occurred, it is put back into the woman for the baby to develop in utero, that is in the woman's womb. Finally, we have intracytoplasmic sperm injection, where a single egg of the woman is being injected with a single sperm cell of the man. Now that we know all this, for me, prevention is always better than cure. So what are the ways of preventing it? It's easy to prevent this if you know the predisposing factors or the causes, like I said. Now, one way of preventing this are lifestyle modifications, which include, obviously, quitting smoking and drinking, as well as maintaining a healthy weight, which can be done through watching what you eat, eating very healthy, very important. Also, limit your exposure to harmful chemicals, radiation, I said, chemotherapy, I said as well. So those people who work in areas like this have to be very careful, as well as not exposing the testicles for heat for a long period of time. And with that, we've come to the end of this video. If there's any question or recommendation you have, please leave it in the comment section down below. Until I see you next time, bye lovelies, and God bless you.